Hello everybody. So today's video will be on IHC markers Ck7 and Ck20, which is the most common screening marker used for metastatic cancers. So as you can see in this image, there are Ck7 and Ck20 can either be positive or negative, and based on their combination, we can differentiate between the various primaries. So Ck7 and Ck20, what are they? So this cytokeratins, these are intermediate filament cytokeratins. So the main use is they help in identifying the site of origin, and they're used for metastatic carcinomas or carcinomas of unknown primary. So based on whether Ck7 and Ck20 are positive or negative or the varying combinations, we can try to rule out or come to a differential to where the primary is arising from. So usually we don't use IHC alone, it is always interpreted along with morphology and other specific markers following the initial subclassification. Ck7 is commonly positive in the normal tissues of lung, breast, biliary epithelium, thyroid and ovary, and Ck20 in GI tract and urothelium. So based on this, we will realize that the tumors that arise from those particular organs are also positive for Ck7 and Ck20 respectively. Then there is this combination where a tumor can be Ck7 positive and Ck20 negative. So this helps you further narrow down the differential in these metastatic cancers. So you can see that Ck7 positive and Ck20 negative, the common tumors are the lung adenocarcinomas, breast carcinomas, thyroid carcinomas, biliary and non-mucinous ovarian carcinomas. Whereas the opposite, that is Ck7 negative and Ck20 positive, is seen in colorectal carcinomas. Both positive, that is Ck7 positive and Ck20 positive, is seen in urothelial carcinoma, mucinous ovarian carcinoma and some gastric and pancreatic tumors. Ck7 negative and Ck20 negative, both negative, is seen in renal cell carcinoma and hepatocellular carcinomas. So where do we use them? As we know that we use them to narrow out our differentials in a carcinoma of unknown primary or a metastatic carcinoma at the time of diagnosis. This Ck7 can be and Ck20 can be used to differentiate the various cancers. However, they are not used alone. So after your initial panel, you will have to use other markers such as CDX2, TTF1, GATA3, PAX8, ERPR, which are more specific for those particular primaries. These two markers, they are not 100% specific, but they help us to narrow down our differential, and the patterns may vary in poorly differentiated tumors. And hence we have to always correlate with morphology and radiology when we are getting varied expression of these particular markers. Practically, this combination of marker is among the first markers used for screening of your metastatic carcinoma, and they are reported as positive or negative. And along with this, you can go in for further IHC markers, go by the clinical context and radiology findings. Thank you.